Hormonal birth control. It can prevent pregnancies, help regulate a woman's menstrual cycle, and cause blood clots. Let's talk about it. My name is Calista Glover, and I'd like to discuss the side effects and symptoms that come with hormonal birth control that women should be aware of before they decide to start taking it. Now, this is just a disclaimer. I am not anti-birth control. I do believe that birth control is useful and can have many benefits, such as preventing pregnancy, helping regulate a menstrual cycle, and it can ease symptoms that come with endometriosis and PCOS. However, I also believe that there are a lot of harmful side effects that come with hormonal birth control that a lot of women aren't made aware of when they start taking it. Some of these side effects could include things like significant weight gain that is hard to lose, mood swings like anxiety and depression. It can also cause things like blood clots, strokes, and heart attacks. For me, it caused blood clots. When I was about 16, I started taking hormonal birth control because I had a problem with hormonal acne, and my primary care physician thought that hormonal birth control might be the best bet for that. I started with the oral contraceptive that had both estrogen and progesterone in it. But because I had a horrible reaction to it, which caused horrible cramping, and it caused my menstrual cycle to be irregular, she decided to switch me to an oral contraceptive that just had progesterone to it. A lot of women who take the progesterone pill is usually because they have sensitivity to estrogen. And this can come in things like making your menstrual cycle irregular or causing headaches, which is what happened with my sister. Well, I was taking the progesterone pill and I took it for several months. And later on, when I was in volleyball, because as a teenager in sports, that's what I did, I started noticing I was having a lot of trouble with my athletics. When I would run and do drills, my chest would hurt, I would get very pale, and sometimes if I pushed myself too hard, my lips would start turning blue, I couldn't breathe, and eventually I'd pass out. This was highly irregular for me because I was very fit when I was a teenager. I could run a 5K easily, and on the days that I didn't have practice, I regularly went to the gym. So because of this, I brought this to the attention of my primary care physician, and she started doing tests and started recommending me to go to different doctors to see if I might have problems with my heart. For the next 9 months, we did multiple tests, which included EKGs, blood work, and I even had to do a breathing test to make sure there wasn't any problems with my lungs, since I had such hard time breathing whenever I tried to do anything that would raise my heart rate. Every time I would go to the doctor, they would find that there was nothing wrong. All of my lab work would come back normal, but I obviously knew that something was wrong because I couldn't do half of the things that I normally did. Along with the chest pains and having trouble with exercising, I was becoming very fatigued. I would sleep for 12 hours a day, and I would get up to do schoolwork. I would be up for about 2 hours, and I'd be ready to go back to bed. I would have horrible mood swings where I would have euphoric highs and depressing lows, which made me believe for a time that I might actually be bipolar. Along with that, I was having very bad reactions with my skin. I would get very sick very easily, and altogether, I felt like I was dying. It took us 9 months of going back and forth to different heart doctors and taking different tests before my primary care physician decided that she would do an x-ray on my chest. When she did, they discovered a small mass in my heart that they believed was a blood clot. The only thing that I was taking at the time that could have possibly caused a blood clot was my hormonal birth control. My primary care physician immediately took me off the birth control and put me on a blood thinner, and within a few months, I was acting like a normal person again. However, I still have a lot of problems because of that. As of now, I cannot do any type of cardio without my heart rate spiking to levels that are above normal. And I still have a lot of issues with mood swings, and I still get sick very easily. I think that women should learn more about the side effects that come with birth control, so no one has to go through what I went through, and no one has to go through months of not knowing what's wrong with them. One of the problems that come with birth control and the doctors pushing it is because they don't tell women some of the side effects. A lot of women come in thinking that there's something wrong with them when really it's just a terrible side effect and they might need to be put off birth control. Thank you.